Please, please, please give the supply of oxygen to the hospital.
Our health system is already broken.
Imposing a lockdown will reduce cases because evidence suggests that it doesn't reduce cases.
I want to go first to Swapnil Parekh and get him to explain at the outset the rationale for why you believe a national lockdown at this stage is what India requires.
The current number of mortalities that we are seeing, these represent infections that have occurred a few weeks ago when the numbers were much lower. We know that the numbers have increased exponentially since then. Our ability to find cases is limited by our testing. So in a few weeks, we're going to see hospitalizations and deaths due to the infections that have occurred today. And we already are struggling. Our health system is already broken. So we urgently need to reduce the number of infections. And unfortunately, we have backed ourselves into a corner where a socio-economically difficult lockdown is our only tool that can preserve health capacity. And it must be accompanied by economic packages to prevent financial ruin for the most impoverished Indians.
My fundamental issue with the lockdown is that the basic premise that lockdowns will, stop or break the chain is fundamentally not true. Let me give you an example. Delhi has a lockdown and we know what's going on over there, right? Another counterpoint that I have is that if you look at the mobility indices, our mobility indices indicate that the mobility levels in India are similar to what they were during the lockdown. Yet cases are, increasing, and they're increasing at a faster rate. So we cannot be certain that imposing a lockdown will reduce cases because evidence suggests that it doesn't reduce cases.
We need a breath of relief among the healthcare workers. The oxygen supplies will obviously be bolstered to a level that's acceptable in a couple of weeks, which hasn't happened so far. And hopefully the supplies of essential drugs will also be eased out over the next 2 or 3 weeks because international help is on its way, domestic capacities are being ramped up. So I think that initially the lockdown last year was done to get the healthcare system in order. This time it's definitely firstly meant to break the chain of transmission.
After 15 months of this pandemic globally, and more so in India now in the second wave, to have a comprehensive pan-India lockdown is like throwing a nuclear weapon on India. 4 to 8 times is the indoor transmission now of the mutant strains. More than 55% of worldwide transmission actually now is happening indoors. So by keeping people closed down inside, we are not going to break the chain of transmission, we are only delaying the inevitable. What we need to now focus on is recalibrated strategy in public health. We have to push the vaccination like never before, but we must know which strain we are dealing with.
The thinking in the government is that the lockdown is always the last recourse. When you are exhausted all your options, then the lockdown can be considered by the government, and that is something which is very, very important. And the Honorable Prime Minister has very clearly stated that it is the last resort, if at all government has to consider it.
We are told that Batra Hospital now doesn't want to have any more beds because you are worried about the oxygen shortage.
See, what is the treatment of corona today? It is an oxygen, drugs and vaccination. Nothing is available. Oxygen requirement is about 8,000 to 9,000 liters per day. One side government is saying there is a lot of oxygen in our country. One side people are saying we are not lacking in oxygen and medicines, but still the patients are dying. Oxygen, which is the only treatment, there is no debate in the corona treatment is oxygen and which is not available to the patients.
What is the government saying, Dr. Gupta, every time you ask them? This seems to be a daily problem at the moment.
Opening a makeshift hospital is not an alternative for these therapies. You are providing oxygen there. What our hospitals demand is, please, 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 give the supply of oxygen to the hospital by A or B or C. This is the lifeline for the treatment, number one. Number two, supply maybe twice a day, thrice a day, but we should not be begging for the oxygen. We should not be going from pillar to post for the oxygen. This should be an automatic supply.
Now in cities, the tankers, like these companies come and give you oxygen to the hospitals per day. Whereas in districts, what we are seeing is many of the districts, the hospitals are taking cylinders and going in to refill. So there is a dichotomy between cities and districts where management is happening, and obviously the denominator is that oxygen suppliers have certain amount of capping on which their oxygen thing is there, and the demand is doubled. So this is a very dynamic, complex situation, and further adding to this is the logistic issue.
What's the solution? If it's a logistical nightmare, what is the solution?
Unless each oxygen manufacturer, the big players in the oxygen manufacturing units, if their allocation has not increased, number one, and number two, they also need to be supported logistically, which means all these argon vehicles or these oxygen carrying vehicles which industrial purposes are being used will need to all be directed towards oxygen transport, because it is not just manufacturing now or allocation, it's also the supply logistic chain that needs to be matched.
Delhi government has sought the assistance of the armed forces. 1,000 ICU beds, 10,000 oxygen beds to be manned by armed forces personnel to help battle this surge. Has the request reached you as yet, and can the forces set up additional field hospitals in Delhi?
The armed forces is ready. It has been ready for a while, and though we've been fighting this war against COVID for the last 14 months, I assure the nation that we are all ready. I think we've been already working, and our chiefs, the CDS, they've all reassured the Prime Minister that we will continue to do this in every possible way. As far as the patient load, well, we are taking a huge burden. In all our hospitals across the country today, we have more than 9,000 COVID cases who are admitted. We have taken on all the veterans and their dependents, which form a huge component which would have otherwise taken up beds in civil hospitals which are empaneled for their care. But to vacate out those beds and facilitate our veterans, we've opened our doors and our hearts to them. So they're taking on all that. In addition to that, we're also looking after, within our service hospitals, wherever the district authorities have asked for, our local commanders have made the beds available. We're also looking and preparing ourselves to take on such responsibilities given to us in other parts of the country as well.